So hypothenar mamillary push, we do the lateral flexion component, of which there are two types. We've got the approximation and we've got the distraction component. So get your patients into their position, side-lying position, hands where they need to be. So we'll start with the approximation. So this one, theoretically, the patient would be in a concavity where the concave side would be facing upwards and the convex side would be facing downwards. So how we would do that is by elevating the patient's neck. We could also get her to lie on that affected arm. It does say that in your notes. However, I feel that then we don't have the traction in the patient's upper body to do that. Okay. If we were on a table where we could drop these pieces, drop them into more of a concave position, then it would obviously enhance that positioning of her. Okay, so we're always going to contact the top vertebra. So if I say to you to do a L3, L4 left lateral flexion restriction, we're always going to contact on the top vertebra. Okay, so say this would be an L3. I'm not going to go through, I'm just going to do a general contact, but you would do a proper level count. Okay, getting over my patient, thigh to thigh contact, but now my line of drive is going to be not just a P to A, which would be in that direction, it would be a P to A with a bit of a inferior direction. Okay, obviously depending on the size of your patient will depend on how much body drop you need. Okay, components. Okay, again, getting the patients into that position. Same setup as before, okay, but now we want the convexity to be facing more superiorly. So how we would do that would be either by placing a pillow underneath the side of her, lifting her up to distract those joints. So again, if we stick with say an L3, L4, we're contacting the top vertebra. So the line of drive, so again, skin slack, okay, getting over onto my patient. But now my line of drive is going to be in a inferior to in a P to A and a more cephalad direction. So like that. Again, depending on how much body drop you require for your patient.